Hi everyone. So I'm just going to summarize some of the challenges for the US to adopt a system such as that of Singapore's. I think there will be several challenges faced in transitioning the US healthcare model to mirror that of Singapore's. For one, there will be serious political resistance, as Americans are very wary of government involvement and will likely resist mandatory saving programs such as MediSave. Shareholders such as insurance companies and pharmaceutical companies would also not accept a model that reduces profits for them, and Americans are also less likely to settle for medications and treatments that are not the most advanced and would reject lower cost medications. Unlike the US, Singapore has a centralized system, and reforming efforts in the US would be very complex and expensive. One of the challenges that I think maybe could be changed within the US healthcare model would be personal responsibility. So in the article, there was a statement regarding the U.S. population health, and that really stood out to me. The article noted that although people in the U.S. are living longer now, they are not necessarily healthier. And I think that this statement highlights the challenges making Americans take personal responsibility for their own health. It's not really something that they do. Americans rely so heavily on medical innovations to control chronic conditions such as diabetes, heart failure, and other things that without medications, they will most likely not live as long. And as a result, I think the healthcare expenditures in the US are very high. However, in the last couple of years, I have noticed that there's a shift in social media that really focuses on healthier living options. So some of the biggest influencers that I see on TikTok or Instagram, they seem to be focusing on more natural remedies, more active lifestyles. And I think that this trends are starting to pick up some tractions, and perhaps they could influence the new generations to seek more natural and active lifestyles as well as eat healthier. However, I do not think that older generations will accept these trends, and they will likely not be able to overcome the challenge of taking personal responsibility for their chronic illnesses. And if the US were to move to a model like that of Singapore, I think that the research field, which is what I work in, I think it would be very heavily impacted by the change of healthcare model to that of Singapore. Pharmaceutical companies, they are heavily invested in patients with chronic illnesses, and innovations are driven by the need for newer and more convenient drugs to allow patients to live more comfortably with their chronic conditions. A healthcare model that is driven by promoting better healthcare outcomes and preventing long term illnesses would significantly reduce profits for pharmaceutical companies. And I think that this line of work would be very impacted and will likely have to shift towards more observational or AI preventative care healthcare trials, such as diabetic retinopathy screening machines, which is something that we already started doing, but it's not as common. And I think that this would perhaps be the focus if we were to change to that.